Hi, Marianne.
Hi, Dr. Boger.
Welcome back.
Thank you.
Yeah, how are you?
Yeah. Well, I'm good so far, but that looks pretty ugly.
Yeah, when you see them up in front on the screen like that, they look a little different, don't they? Well, that's what I wanted to talk to you about. You know, like many of our patients who come in here, especially if they're over 25 or 30, many of those patients do have a lot of what we call amalgams or silver fillings in their mouth. And usually if those have been in the mouth for over 5 years, they're starting to show some signs of breaking down or they're defective. And the thing about that is that people don't really realize that patients don't realize that unless someone's told them that, because they don't hurt usually. I mean, decay does not hurt. Hardly ever does decay hurt. Broken down fillings and open margins and leaking areas in the mouth don't hurt. So patients don't have a good tip-off that anything or any suspicion that anything's going on in their mouth, again, unless they've been told about it. But that, nevertheless, the decay process just keeps going on and on and on until the decay gets deeper, and we end up with more dire circumstances for the tooth, even into extraction of the teeth. Now, it takes a long time for that to happen, but we do see that. So what I see my goal is, or my job is to do, or my responsibility is to help a patient recognize disease processes that are going on in his or her mouth, and to diagnose those and then propose treatment plans that will take care of the situation but also last a long time. Because what often happens out in the real world is that these silver fillings are just replaced with larger silver fillings or mercury fillings. They're chiefly mercury, so I refer to them as mercury fillings too. So these mercury fillings are left in the mouth, and they're just watched, or they're replaced with bigger ones that start the same breakdown process to where the tooth finally has to have a full crown done or even is lost. So our goal is to intercede at a sooner point, to recognize what's going on, talk about options for treatment, and then moving forward with those options. Does that explain to you what you think I'm talking about?
Yeah, I mean, I didn't realize that filling material didn't last a lifetime.
Right, and people don't realize that, and they're not told that, and but really nothing lasts forever. The mouth is a very hostile environment, so that in terms of our chewing and the acidity, the pH, the different things we eat, all play a factor in how long things last in the mouth. But certainly some materials last much longer, and some materials are much more conservative in terms of how we treat the teeth, and that's kind of what I want to address with you.
Okay.
Okay. Mm-hmm. So if we just start out by trying to recognize what the issues are, if we look at this picture of yours, this happens to be your lower right first molar, so it's down over here. Okay. And we have this really, what we call a three-surface amalgam in your mouth, or mercury filling. You can, if you look, when you have a picture like this that's blown up, you can see where the tooth and the filling meet. There's a little opening, isn't there? You can see kind of a gap there. Mm-hmm. And if you can see that, if we can see that a little bit with our naked eye, you know that microscopically that's just a huge canyon that bacteria percolates in and out of every time you eat and chew on that tooth. So what happens is that as that happens, and as there are particles and molecules of food in your mouth, or substrates for the bacteria to act on, that the bacteria that do get down between the tooth and the filling and inside your tooth do start to cause decay as they ingest or assimilate the food particles that are in your mouth. And if you look at this picture, you can kind of see kind of a halo here around this tooth, and that is usually two things. It's some stain from the filling itself, but it often, and in this case, I think it's also showing decay. Now we hardly ever remove a filling like this without finding frank decay underneath there, or cavities, because the bacteria has been acting for a long time under there. This has been going on for a long time, and you're unaware of it because it's not hurting you at all. We take this out, and all of a sudden we've got decay underneath there. And so what do we do with it? It becomes the next question. You can also see that silver fillings, because they're not bonded to the tooth, when you bite on them, they actually move a little bit. They actually, what we call creep in dentistry. And this creeping can lead to fractures in the tooth, and you can see this fracture line is starting down here from where this filling and the tooth meet. Can you see that?
Yeah, that brown line.
Right, right. And you can see one over here too. Now you have several of these in your mouth. In fact, if you look in this picture of the tooth right above it, again, you can see this gap starting to form up here. Maureen, do you have a picture of the second molar? So here's the tooth right behind it, Marianne. Thank you, Maureen. And you can see this is a larger filling. Again, you can see where she has her arrow there of all these gaps that we have between the filling and the tooth. Really large, aren't they?
Is that gap that real dark line?
That's that real dark line, and even here you actually have a hole next to the tooth. Now it doesn't hurt either, does it? Down here in the lower right. Let me chew on it. If we lifted that filling out today, it would just be black under there. So, so there is active decay there, or active cavity going. You know, people often are aware of the term cavity more than decay. And you can start to see a fracture line starting here. When we go to treat these, Marianne, is where I think we're a little different than a lot of practices, because we have the options for treating this. When you look at this, and you, let's just talk about the options when you see this in the mouth. One is to do nothing and let it continue to decay. Obviously not a great decision, but it is done a lot of the time with more dire circumstances to the tooth, as I referred to earlier.
Well, what would happen if I chose to do nothing?
The decay then could proceed to the point where it actually got into the nerve of the tooth, and now you have an endodontic treatment or a root canal done on the tooth.
Oh, that doesn't sound good.
Well, actually the treatment itself is often not that bad, but it's another procedure done to the tooth. It's another expense. It does make the tooth weaker, root canals do, because they now have no blood supply, so they dehydrate over time. It requires a more extensive treatment to the tooth if it's had it needs what we call more full coverage if it's had a root canal, because the tooth needs to be protected more. And then you always have the chance of the root canal fracturing later. Now that doesn't always happen, and surely we don't hope that that happens, but you can see how one step can lead to another, and all of a sudden we're into a more significant treatment, more significant cost, and loss of tooth structure, a much more aggressive type of treatment needed to be done at that point. And really, I'm all about conservative and being proactive. So we want our patients to at least have the option of knowing about these options, about the circumstances, the diagnosis, and then the options for treatment. So they're real clear about that and can make a decision based upon facts. Okay. So when we look at that tooth, and even the tooth in front of it, and we'll talk about your whole mouth, but just to look at those two teeth and talk about options, we talk about, again, as I said, one option, which really isn't an option, is to leave it alone. Two would be, especially in the position of this tooth, we could just put a full crown on that tooth. We could take all the silver filling out of that tooth and put a full cap. You might have heard the term cap. Put a cap over that tooth, and that would serve as treatment. That is, in my opinion, that's too aggressive for that tooth. I think we can do something to that tooth that is not as aggressive and still have the same result in terms of longevity or even longer. Another option would be to simply put a filling, as a composite resin, a tooth-colored, bonded filling into that tooth. And that actually would be the second on the list, probably, would be to talk about a big filling, because it's the next least expensive thing to do. We could put a filling in that tooth, but that filling will still be larger than what that material was designed to be used for. And over time, even though that filling will now be bonded as opposed to the filling you have there now, it will also break down over time because it's too big. There's too much surface area. So as you chew on that filling, over time, that filling will break down too. But it is an option to go in there. We could go in and do composite resin fillings. They have no mercury in them. Not that that is an issue or isn't an issue to you, but that's a fact. There won't be any metal in a composite resin material. It is bonded to the tooth. It is tooth colored. So it has those advantages, and often that's what we do, especially if they're smaller. If the old silver filling we're looking at is a tiny one or a smaller one, it's an appropriate treatment because it'll last a long time. But when you get up into the medium to larger sized ones, I don't feel it is the right option because you're going to have to retreat that tooth sooner rather than later. The option that I'd like to talk about with these teeth most often is when we do a bonded porcelain restoration of these teeth. And the reason I like these restorations is because when we do them, we can be much more conservative with how we treat the tooth. We don't have to take away, for instance, on this tooth, we would not have to take away all of this enamel here, all of this enamel here. We wouldn't have to take away the enamel on the inside of the tooth, just on the top part here, because we can bond the porcelain to the tooth. I don't need the physical retention that a crown needs or a cap needs of fitting over the whole tooth. So we can take away a lot less tooth structure. We can put a material on there that is bonded to the tooth and by many studies is as strong as a natural tooth is without any work being done on it, with proper techniques and proper bonding technique and proper materials. And we can have a result that's very aesthetic. You can't tell that it's not a tooth. So so that's where I like to go with most of these restorations, because we can end up with a very long-lasting restoration that is beautiful, that is extremely strong because it's bonded to your tooth, and it's more conservative because we can leave a lot of your natural tooth structure there. So as we go along, I'm going to show you how that works and how those restorations might be appropriate for you.
Well, you said it would be porcelain?
They'll be porcelain, yes.
To me, porcelain sounds fragile. Is it?
Right. That's a good point, Marianne, because porcelain, if we take one of these porcelain restorations and just have it in our hand, and I was to pinch it, I might be able to break it, especially if it's thin enough. And when we put veneers on teeth, you might have heard about veneers, those are also porcelain, and they're very, very thin, and you definitely can break one of those if you had it in your hands. But once that porcelain is bonded to enamel, once it's bonded to your tooth structure, it becomes extremely strong. And as I said, we can refer back to tests that have been done on bonded porcelain restorations and see that they are indeed very, very strong. And I can show you some of those studies.
Okay.
It's a great question. Yeah, and we get that a lot. But it's where dentistry's headed, and it's where dentistry should be and needs to be, I think, right now in terms of helping people get more permanent restorations, have it be cost effective, have them be long lasting, and have them be conservative. Does that make sense?
Yes, it does.
Awesome. Well, what we'll do is we'll look at, and we've just talked about 2 teeth here, but I want to sort of introduce you to that idea, and then as we go through the rest of our diagnosis and treatment planning, you'll understand that piece of it anyway.
Well, I definitely want to get the decay out and save the teeth, and it'd be nice not to have gray in the mouth.
Yeah,
or black.
Right, and nobody wants that, do they? So, but that's just kind of a side benefit from actually. Now, for some people, that is the primary benefit. For some people, when they come in here, the thing they care about the most is we're going to get rid of those what they call blueberries, or these dark-colored teeth they have up here, where the silver fillings are actually showing through the teeth. But for others, so for some people, cosmetics is the primary concern. For some, function is the primary concern. But for both of those people, we have the answer in the same restoration, which is really cool. Yeah.
Well, thank you.
Thank you for your time today, Marianne.
Yeah.
And we'll be talking more about this. Okay.
Okay.
All right.
Okay. Thanks.